Hi, my name's Deb Weatherelt. I am the Idaho Sexual Assault Nurse Examiner and Sexual Assault Response Team, or SANE SART, Coordinator. We're going to talk with you today about the development and implementation of this role. To do that, we need to go back to the beginning, which, oddly enough, is an old abandoned or almost abandoned warehouse in Detroit, Michigan, where in 2009 a routine police audit of their evidence revealed over 11,000 unprocessed sexual assault kits, some of which had been in that warehouse for over 40 years. Obviously, this started quite a discussion in Michigan, and that expanded to become the discussion about backlogged sexual assault kits across the nation. The conversation came to Idaho, and our state crime lab said, "How are we doing? Do we have a backlog?" A group was formed called the Idaho Sexual Assault Kit Initiative, or ISAKI, a group of multidisciplinary professionals from across the state to see how we were doing. An audit was done with law enforcement from across Idaho, and eventually we found that our unsubmitted kits totaled a little over 1,000. The ISAKI group sat down with the state crime lab, and they worked on bringing in newer technology and revising processes to streamline how kits are processed and improve efficiency. We're proud to report that as of December 21st of 2021, our last previously unsubmitted sexual assault kit was processed. Idaho's backlog is officially done and gone, and we have processes in place to ensure that we won't be faced with a backlog again. ISAKI could have disbanded, but they didn't. For through conversations of learning about our kits, we learned a little more about sexual assault in Idaho and the lack that we had. We found that we didn't know where exams were being done. We didn't know who was doing those exams. How had they been trained? There was a lot for us to learn, and the group undertook that. They developed a goal called SANE 250 once they realized that there were places in our state, unfortunately many places in our state, where when a patient suffered a sexual assault, they couldn't get a sexual assault kit collected. That needed to change. SANE 250 was developed. The goal to train 250 nurses in Idaho to perform sexual assault or medical forensic examinations. It quickly became apparent that someone was going to need to spearhead this project, and the need for the coordinator role was developed. They worked with our legislature, and the legislature approved the position, but as legislatures often do, they didn't attach any funding to that. So ISP wrote a grant, and the position is grant funded. We'll talk about that a little bit more. We did hire a sexual assault nurse examiner who was an experienced SANE, was certified as a SANE, and could teach. And she immediately jumped into the role, created the 40-hour SANE course that nurses need to take to be able to become proficient in doing these examinations, had it approved through the International Association of Forensic Nurses, and began teaching. After 8 months, she had taught 3 classes, trained several nurses, and then felt it was time for her to move on and actually run one of the SANE programs in our state. That gave me the opportunity to step into the role. Now, with over 40 years experience as an RN, and much of that in nursing leadership, I had a strong background in nursing and in project development and management. But I wasn't a SANE. That needed to change, and I was soon immersed in all things forensic. I had a detailed and prolonged orientation with the state crime lab, spending time with every discipline in the lab, getting a strong foundation in forensic as a science. I also sat through untold hours of forensic nursing education. I joined the Domestic Violence and Sexual Assault SANE team and became a SANE there. An important part of what I needed to do was to become certified. And normally, to take a nursing certification requires 2 to 5 years of experience. Frankly, we didn't have that time. And so my immersion in forensics education culminated when 13 months after stepping into this role, I was able to sit and fortunately pass that international certification. What that meant was that I was now qualified to teach or to train nurses. While I was learning, I had been setting up classes across the state, but we had to contract with nurses who were certified SANEs to teach the classes. And Idaho will be always grateful to Jane and Megan, Anita and Karen and Ann and Robin for the help they gave us during that year to train nurses in our state. We have over 9 classes scheduled for SANE nurses through Idaho through 2022, but we recognize that just training the nurses isn't enough. There needs to be a feedback loop. As I travel the state visiting with people, nurses would say to me, "Yeah, Deb, I've had the training, but it's been 8 months and I'm really not sure. I did a kit the other day, but I turned it in and I never hear. Did I do a good job?" It's important to nurses to do a good job. It's important to our law enforcement partners that we do a good job. And so I knew feedback was needed. I worked with the forensic scientists at the state crime lab, and they agreed that each time they process a sexual assault kit, they also evaluate that kit. How well that kit was put together, were the correct swabs used, were the correct number of swabs used, and they provide that information to me. I then take that information and I sit down and write an individualized letter to each nurse who has collected a kit. First of all, I thank them for the work that they do, because it's hard work. And most of our nurses who are forensic nurses in Idaho, as probably is true across the nation, work full-time in other roles and take call to do sexual assault examinations past that. And the work that they do has a powerful impact. It impacts our patients for the rest of their life. We need to be able to do a good job. The letter then goes on to say, on this date, you collected kit number, and here's the feedback for that kit. We would recommend using only 2 swabs when you swab the neck, or we need 4 swabs when you swab a body cavity. Or your patient's history indicated that perhaps swabs should have been obtained from the bite mark on her arm. This helps provide information to them and understanding why we're asking for what we're asking. Feedback has been overwhelmingly positive as nurses call, email, and sometimes even send a letter saying, "Thanks so much." Improving access to standardized care is our goal with this program. One of our newspapers reported quite a while ago now, thank goodness, that a young woman had reported to one of our healthcare organizations that she had been sexually assaulted and she was looking for a rape kit to be done. Unfortunately, the healthcare organization said, "Oh, sorry, we don't do that here, but we want to help, and so here's a bus ticket, and it'll take you about 3 hours to get to Boise. Someone there will be able to help you." I don't know if that young woman got on the bus, and I don't know if she had a rape kit collected, but what we all agreed was this can't happen in Idaho anymore. And so as we worked to train nurses, we worked with organizations, and we're pleased to say that when I started in this role, we had 17 organizations that were providing health care exams for patients who've been assaulted. That number has risen to 25. That is partially due to not only the training that we do, but the ongoing communication. There has to be a steady stream of information out. Idaho is so rural that some of our nurses, after they've taken the course, may not see a patient who's been sexually assaulted for a year or more. It's a little hard to remember all of that information when it's needed. So I do engage in communication on an ongoing basis with all of our programs and with our nurses across the state. I provide a quarterly newsletter called the Idaho SANE SART Update. The focus really is on the medical forensic examination and on evidence collection. I cover all things related to forensic nursing. When the CDC changed their guidelines with erythromycin for sexually transmitted infections, it went into the newsletter. As the 2020 imaging recommendations for strangulation came out from the Institute for the Prevention of Strangulation, it went into the newsletter. As I look at our kits and see an issue, perhaps the wrong number of swabs consistently being used to swab a certain body site, we put that into the newsletter, trying to provide helpful information on a timely basis for the nurses who are doing the work. Another part of my role is to provide technical assistance, so we make sure that my contact information is out across the state for law enforcement and healthcare to call me if they have a question. Twice now I've actually had a nurse call me and say, "Deb, I've got a patient here with me. I need to do an exam and I have a question I'm not sure about." And I actually can help guide them through that exam in real time. I've had a nurse call and say, I've just moved to Idaho from another state. What do I need to do to practice as a SANE? I want to make sure that anytime anyone has a question, they know they can call me. I might not always have the answer, but I can always find it. I also am the SART response coordinator. That means that I attend our local SARTs. A SART is a sexual assault response team made up of at least 4 core members: healthcare, law enforcement, prosecutors, and advocates. These 4 disciplines gather in their communities. That might be a city, although most often in Idaho it's a county. We do have a couple of SARTs that are multi-county, and these people pull together to address sexual assault in their community. I attend SARTs to provide education on forensic nursing, what SANEs are, what they are not, what they can and can't do, and how my role can assist. I'm not there to tell them how to do their job. I'm there to provide resources as they need it. Another of my responsibilities is to update our Idaho Sexual Assault Response Guidelines. In our guidelines, we cover the Idaho statutes around sexual assault, our resources that are available in Idaho. If you're in Cassia County and you want to talk to an advocate and you have no idea where to go, you can look in the resource guideline and you can find that information. We cover best practices for the 4 core disciplines of healthcare, law enforcement, prosecution, and advocacy. We have detailed information on all components of the medical forensic exam and how we need the evidence collected for our state lab. We also cover our Idaho kit tracking system, so we have information there. Our hope is that these guidelines assist organizations as they're developing their own policies and procedures. I'd love to be able to tell you that we just hit the ground running and had no issues, but honestly, there have been some challenges. One of the main challenges was really defining the role and who was needed. Actually, there was some initial discussion that perhaps it didn't need to be a nurse. Through some time, we have found that we really do need to have a nurse in this role because we need to have a certified nurse who can train. But that nurse also needs to have strong leadership because project management is a huge piece of this role. We had to identify our test sites. As I mentioned earlier, we didn't know where exams were being done, where exams weren't being done. There was no central depository of that information. So we really had to work hard to pull that information together and identify all of our hospitals in the state, who was doing exams, who wasn't doing exams, what other organizations were doing exams that we didn't know about. One of our major challenges was helping provide resources to organizations without them feel like the state or Big Brother has just come in, is going to judge us or tell us what to do. This role really truly is to provide education and resources, nothing more. We're not going to come in and take over your program. We're not going to evaluate your program unless you ask us to. We just want to give you the resources and the assistance that you need to run your program. We've identified a lack of knowledge around the trauma response. When people undergo trauma, there actually is a change in how their brain function, and that very directly impacts their behavior, not only through the assault itself, but for up to 72 hours afterward. There's a lack of knowledge and understanding what that means, both for healthcare providers and for law enforcement. And so we're working to address that knowledge gap. COVID, of course, like the rest of the world, has impacted us as we've had to cancel classes, downsize classes to make sure that we could ensure social distancing. The national staffing crunch for nurses has hit Idaho as well. As some of our smaller hospitals struggle to simply keep nurses at the bedside, it's very difficult for them to pull nurses away for training, and we have to figure out ways to address that. The position funding, which I mentioned earlier, limits what I can do in my role as a coordinator. At this point in time, under the grant funding, I cannot teach anything about pediatrics. And sadly, pediatric sexual assault is a topic that needs to be addressed in Idaho. We are cautiously optimistic that the legislature, through the next cycle, will give us state funding for this role, which will remove those limitations. So, like any other program, it seems like the more we do, the more we find we need to do. And so we're moving forward. We're expanding our networking and education for law enforcement, understanding what forensics nursing is and how to interact with them, understanding that trauma response, expanding nursing education. We have not only the SANE education that we're providing, but we know that we need to develop a course on strangulation. Nurses have requested training on human trafficking, so we're looking at expanding the forensic information in those places as well. I'm going to be reaching out to our Title IX officers, those officers in the state who are responsible for investigating sexual assault on any educational campus. How can we work with them to help ensure, again, that all victims have access to standardized care? I also want to improve our cultural competence as it relates to our tribes here in Idaho. We have several tribes in the state, and I want to make sure that our victims who come in feel that their culture and their cultural needs are respected. And one of our biggest projects is our medical forensic record. We know that this is a medical record. We're recognizing this also is a forensic record, which means it's evidence. This came to painful clarity when a law enforcement agency called me and said that one of our patients who'd filed an anonymous kit had come forward after 12 years and said that she wanted to open an investigation. Unfortunately, fully in accordance with Idaho statutes, her medical record had been destroyed after 10 years. That helped us recognize that we have a real problem, and we need to define what that record is and how it's going to meet both the needs for the healthcare discipline and for our forensics and law enforcement discipline. A lot of work to do. We know that many of you are working as well. We hope that perhaps this has triggered some thought about a state coordinator role for you. If so, and if you have any questions, please feel free to contact either Matthew or myself at our emails listed on the slide. Thank you.